Back to school is still weeks away, but students involved in team sports are already back on the practice field, many of them facing rigorous two-a-days. And Dr. Stephen Courtney of Advanced Spine Center in Plano is here to talk about common injuries and how to avoid them with unnecessary surgery also. So first of all, let's start out talking about what kinds of injuries you see. Teens are tough on their bodies with the intense practice and training schedules they face.
Right, it's summertime now, and a lot of people are doing the two-a-days and workout facilities. So a very common thing I see in my office on a daily basis is the facet joints in the lower back. These joints, they become painful, and they're like the size of your knuckles. They're on each side of the back, so they have their own pain fibers. So twisting and turning aggravates those joints. Another very common thing I see is a pars stress fracture. So you get a little bit of a fracture right through here, and then they become painful. The cheerleaders get it, the gymnasts get it, the football players get it a lot, the basketball players, even golfers. So it's a very common problem I see in my office.
So those are some of the most common
problems
that you see. Okay, so if your child comes to you complaining of back pain, how do you know whether to just say, just put some ice on it and let it go, let the inflammation go down, or actually go to a doctor? Because back pain can be a serious
It can be a very serious,
issue.
very good question too. If you give the child 2 or 3 days or 4 or 5 days just of rest, and if they go back to their activity, if it becomes more painful or more inflamed, then you need to seek out attention, where you probably need x-rays of your back, where you do have the child bend forward and backward, get extensive views of the back, get x-rays. If you had spondylolisthesis, which a lot of the gymnasts do, that can be a problem as well. Also get a thin section CT of the back, which shows the bony anatomy a lot better. Then also an MRI scan of your spine as well, if you had bone edema or bone bruise, because bone is painful and it hurts, so if you catch that earlier, you can treat it quicker and more effectively. And also if your child has night pain. If you have night pain, they need to come in sooner to evaluate for tumors. I see about 2 or 3 tumors a year.
Wow.
So sometimes my back hurts, but they can have underlying problems underneath it.
So you mentioned treatment. What is a typical course of treatment?
Right, most of the kids need to rest. Treating back pain is not like it's not like Instagram. You got to be patient with it. You got to be calm with it. You get a heating pad, hot showers. Watch this. Sitting aggravates your back. It's a new smoking. And then anti-inflammatories. Some prednisone can help sometimes as well. And sometimes we put them in braces just to mobilize their back, because most of these kids are too powerful, and they can really aggravate those joints in their back. Very common.
So parents are going to want to know, is there any way for young athletes to prevent this from happening?
Well, there is, usually the athletes, they have their own, I guess their own genetic makeup, and they want to do something. But cross-training is a good thing to do. Like the football players are a prime example. They do a lot of squats, deadlifts, but if they utilize a spin bicycle, you see the Peloton bike, the Tour de France bike, it really helps folks on your quads, your hamstrings, and your glute muscles. So you can substitute that versus big heavy deadlifts and squats. Another thing is swimming. Swimming is a very good exercise. It's lowering your joints on your back. And it's good for cardiovascular as well. But it's a whole different technique in itself. Hot yoga. A lot of the kids don't like doing it, but it's a very strenuous activity. It keeps your muscles moving and warm, and motion is the main key.
I've done a little yoga in my life. It is good for you.
Yeah, I did about 2 years up here in Addison. I almost died a few times, but it's so hot. But it's a whole different workout altogether.
It is good. Okay, you're in Plano. What sets your facility apart?
I see all the patients myself. I go over the X-rays with them myself. I go over the MRI scans with them. I go over the anatomy with them. And sometimes it's just a good idea to see what you don't have versus what you do have. If you understand the anatomy and what can cause the pain, you're more able to deal with it mentally, and get your mind right and deal with it. So I talk to the patients like I'm speaking with you this morning.
All right. Well, thank you very much. I remember those 2-a-day days. So anyway, we appreciate you coming in and telling people this. It's good information. If you're interested, you can call 833-60-SPINE or 972-499-5457 for more information, or just go to advancedspinecenters.com. You can also follow them on Facebook at Advanced Spine Center Plano.